first experience of moral injury that I had where I realised that when I show up to work, I can really cause harm. And I cause harm to a patient.
Hello, my beautiful friends. My name is Dr. Beck.
And I am Christine Barker, and this is Am I Doing It Wrong? A podcast for doctors by doctors. Dr. Beck is a mindset coach and medical doctor who specialises in liberating driven professional women from the limitations of perfectionism, imposter syndrome, and people pleasing. She's basically the cheat code for getting out of your own way, showing up authentically, and living a life you're proud of.
And Christine is a medical educator and nephrologist who creates resources for doctors in training that I truly think are an unfair advantage. She makes complex topics super simple and takes the pain and uncertainty out of passing your medical exams. Christine and I connected a few years ago via our online platforms, and over the years we've discussed countless highs, lows, and in-betweens of doctor life. And in doing so, we've experienced firsthand the power of vulnerable conversations to show us where we're getting in our own way and underestimating our capacity.
So we want you to be part of the conversation and experience these same results. Every week on the pod, we'll be bringing you conversations which shine light in dark places, normalise the doctor journey, ease unnecessary suffering, and give you actionable steps to thrive in all facets of your life. So grab a cuppa and get cozy for this week's episode of Am I Doing It Wrong? The podcast for doctors by doctors.
Hello, my beautiful friends, and welcome back to our podcast. We are so happy to be here again with another week with you guys.
And this week, we're going to be talking about moral injury. That's the theme for today. And the reason for that is because I'm going to tell you that it's fresh for me. So I'm not going to tell you the fresh story. But yesterday, I had an incident of moral injury that has sparked the want to talk about it here on the podcast. And obviously because it is very close to me right now and it might identify some of the systems and things, I'm not going to go into that in detail. But I believe it's happening to all of us all of the time on a regular basis, and I think it's worth talking about. But I want to sort of transport us back to probably the first experience of moral injury that I had where I realised that when I show up to work, I can really cause harm, and I cause harm to a patient. So I was a renal registrar. It was my first year of training, and I was on the weekend by myself. It was maybe like the middle of the year, so I had done some biopsies and things like that, but I was by no means an expert, and I was asked to do a renal biopsy on a young person. He was only in his 20s, all by myself on the weekend, unsupervised, unsupported, and that did not go well. As soon as I fired the needle, he was screaming in pain. I've really, to be honest, I don't think I've ever seen anyone in that much pain in my whole life. It was just watching him be in pain was in itself agonizing. His mum was in the room, extra agonizing to watch her son in pain, and I'm watching this whole scene that I've just caused, and I'm trying to put pressure on his back, but then I realize something's very wrong here and I'm by myself and I need to go and get help. I started to faint. It was not good. My nervous system was not happy. So I popped him on his back and went and sort of gathered myself and tried to fix the situation. So from there, we realised with scans and all the things, he actually had a very severe bleed from one of the kind of major arteries inside, like a muscle on his back. And he had to have angioembolization, so contrast. He already had an acute kidney injury. He had to have blood. There were so many things. I have never caused so much harm to a person ever since, I guess. That was the worst case. And I guess just as I'm talking about this, I can feel the feelings that I felt on the day, but it was really quite a devastating experience. And although the patient was delightful, we had consented for the risk of the procedure, they really took it in good spirits. The patient was amazing. They weren't the problem. But I was not only the doctor on the weekend, but I had to then continue to look after that patient throughout the week. So every time I saw the patient, every time I looked at his hemoglobin, I would feel viscerally sick. Every time I did a biopsy from then on for the rest of the 3 years of my training, I would also feel viscerally sick. But it was, I guess, that was the scene. But I thought what we'd unpack today is how you actually deal with that, because I felt so terrible in that moment, but the truth is that although time did kind of heal it a little bit over time, it took me months to get back to what I would regard as normal from that event. And I guess I'm just thinking about all of the doctors out there who are doing procedures, who are going in there. All of these procedures have a percentage risk. We're also training to do the procedures, and so that obviously comes with perhaps extra risk. And I think it is a big problem that I don't know that we have a way of supporting people in that situation, supporting ourselves in that situation. I was completely lost, and talking about it now, I'm just it's raw. It feels raw still. So thanks everyone for listening. Probably going to get some therapy from Beck now, so that's the good news. But I guess just having that story that I'm sure is familiar to lots of people listening, and if you haven't had this story already, I actually hope you never experience this, but if you're doing procedures, you will probably experience this at some point. What would you sort of say to someone in that situation? If you could go back to that time with me, if you were coaching me at that time, or if I came to you with that problem, how would you help me work through that?
You know what I'm going to say already, Christine. I'm not going to dish out something to say to you or something to ask to you, but I'm going to be really interested in what's going on in your mind at the moment, because, I mean, we can react to these challenging situations in such a wide range of ways. You know, it's actually possible and perhaps normal for some people to go through that situation. Say it was their first difficult situation as a training doctor, or maybe it's their 10th difficult situation as, you know, a senior consultant, and they don't have that same emotional response, that same emotional impact from that scenario. And that's largely because they have different thoughts, and the thoughts aren't something that is, you know, thinking is not something that necessarily happens on purpose or rationally, as we often think when we talk about thinking, but instead, your brain has pulled forwards certain thoughts in that moment about what this means about you as a doctor and how morally good or bad this was, based on all these other experiences you've had in your life. So we always want to get really interested in what are your thoughts about that situation? Why was this so challenging for you? Because we'll find that answer for you in your thoughts. As you were describing, there was a point in the story where you were saying, I was checking the hemoglobin each day. And when you said that, I saw myself, and I can't quite grab exactly where this happened to me, but I can remember that reminded me emotionally of being in that same position where I had patients where I had done the wrong thing. In my mind, I'd made a mistake, I'd missed something, or I'd overdone something. There was some mistake in my mind in some way. And I had that same sort of emotional response and attachment to checking their progress as it went. So I wish I could retrieve that specific episode at the moment, but it feels like more than one episode too. I feel like I've been in that situation multiple times, and perhaps I didn't have the level of responsibility to be doing a renal biopsy, and therefore the consequences probably weren't as serious for my situation. But it feels so familiar to me to have thought and perceived that I've done the wrong thing. I've done wrong by the patient. I've harmed the patient, obviously all unintentionally. It probably, well, always in the context of having the best intentions. But doing that harm to the patient is such a difficult thing for most doctors, if not all doctors, because, I mean, what's that line in the Hippocratic Oath again? Do no harm. And when you hear it there, it sounds like the absolute obvious minimum. Do no harm. It's like, yeah, sure, no problem. I'll do no harm. I'm not trying to do any harm. No problem. I've got this. But when you're actually in clinical practice, and even today, I know that so much of my practice, I will err on the side of tiptoeing around and probably being a little bit afraid, a bit on edge at all times, to not unintentionally cause harm to the patient. It's definitely something that is on my mind, that I'm very wary and very afraid. I'm very aware of how easy it is to do harm and do the opposite of what you want to do, which is help. So thank you so much for bringing this topic forwards. And let's start to look at this specific scenario just as the example for you. And then we can offer some of your thoughts out to everybody who's listening that I'd be willing to bet a lot of my money's on being very relatable to other doctors as well. So can you can you name any of those emotions that were grabbing you as you were telling us that story?
Yeah, absolutely. And you're right. I guess like just on that, I can feel them in this scenario. And you're right. If you ever have that thing where you feel like you've made a mistake and you're tracking a patient, it is exactly the same scenario. So relatable. I think the strongest emotion that I can point out is guilt. Like it's a guilt and it's a sadness. And then there's this kind of, you just feel entirely rocked to your core, as if you're not who you thought you were, or that's maybe not a feeling. I'm not good at the feeling thing, you know that, Beck. Guilt is the dominant thing. Guilt that makes you want to cry. Guilt that like feels like a dark cloud that won't leave you when you go to bed at night, when you wake up in the morning. Guilt. That bad. Yeah, that's the dominant one. There's probably more, but that's the one that comes through. Yeah.
Yeah. Oh, and that feels so important in this scenario, because the message of guilt often is, and correct me if I go off the mark here for you, but the message of guilt is often, I've done something wrong, isn't it?
100%. Yeah.
That's what guilt is there to tell you. And then you also said, you took it one level further when you said, I'm not who I thought I was.
Yeah.
Does that thought feel real to you, or does it feel sort of distant?
Like it feels in that moment, like obviously a few years have passed and I would be able to hold space for, well, I think that's the other thing to say, is that when this happens to someone else, if someone else is in the same scenario that I was in and causes a problem, causes harm as secondary to a procedure, including very experienced surgeons or people in training, doesn't matter who it is, I don't tend to judge that. And I don't tend to have any sort of particular, I'm more just, there's a patient who's had the complication and we're sorting it out and we're working together. And often you are having to go back to the proceduralist to ask for help, right? Whether it's the radiologist, the surgeon, like the proceduralist, because it's just they know more about this complication than you do. So you're engaging with it. And when it's that scenario, I'm feeling no feelings. And I'm actually probably now having my own experience, feeling extreme empathy for them and admiration for them that they do procedures that have such gravity. So when it's someone else, it's different. But when it's me, I think it is because I'm turning up to work every day. I mean, I don't identify as a surgeon, first up. There's many reasons for that. Clumsiness being one of them. But I don't really want to be that kind of doctor. I want to be more of a communicative doctor, chit-chatty, prescribing things, having to think about how the body works. That's my jam, issues lists. But I want to, ultimately, I feel like my expectation is that when I show up to work, I'm going to have a positive impact on the patients, on the staff around me, and I'm going to go home. And I signed up to med school with all of that same belief system. And then it was like, I've just fired a needle. Someone is screaming in pain. They're now like they're losing, they're in a bad way because of what I've just done. And I am feeling like completely discombobulated. Like, what's this doctor thing all about? Like, I now don't know whether, usually, actually, that's a good point. Right after one of these scenarios, be it what you were talking about, where you feel like you've done something wrong on a mistake type thing, or when you've caused this harm, my instant feeling after the guilt is maybe I shouldn't be a doctor. I don't want to be a doctor because I don't want to feel like this, and I don't want to do this again, and I don't want to go back in the ring. The ring's hard. I don't want to go there. That's where I go. and then I have lots of tears, lots of chit chats with safe friends, and eventually it wears off. But it takes a long time. Sorry, I rambled there. That wasn't what you asked me.
No, it was. You just took it further because so you've taken us out because the question was like, what are you thinking at the time? And then you offered us that thought that was, some thoughts about you which were that you're not who you thought you were. And as you said that, you're almost like, I saw you kind of like almost take it back. You're like, that was a thought, but it wasn't quite right. And that might be because in this moment, as you were saying, like, this is a distant thing that happened a while ago. And sometimes you can say the thought out loud and you're like, that doesn't make sense. I don't really believe that. But in the moment, you very well might have believed it. And then you've got this conflict at the moment because you say you look at other people doing these procedures and you're like, well, I don't make it mean that about them when they have a complication. The thought doesn't even come into your mind that there's something wrong with that they've made. Suddenly just hit the window.
Beck's getting attacked by bugs or something. I don't know. It's a weird pod. It's bad juju. Anyway, carry on.
The thought doesn't come into your mind about them, that this is something personal related to them. But for you, in your case, it does. So there's these different rules and different meaning that we're adding to the situation. And I just think it's so common for us to do that as doctors. This would be a very common scenario. If I was in that scenario, that's where my brain will automatically be going to. That would be my default, to make it personal and question myself in terms of my abilities as a doctor right now, and also my future as a doctor. Should I be doing this? You touched on that as well. And that's what our brain's meant to do. Our brain is meant to be keeping us safe all the time. And we know it's important to us that we are good, safe doctors who help patients. That's our identity. And if we're going to put ourselves in a situation where we're not being a good, safe doctor, that's threatening to us. It's threatening to our identity. It makes sense that we would be concerned about that threat and that your mind would bring it forwards. It makes so much sense. And it also explains why it's easy for your brain to go there in that moment, but you don't necessarily project that onto other people when they have those situations because you're not concerned. I'm sure you care very much about your surgeon friends, but you're not primarily concerned. Your brain is not primarily concerned for their safety. And in fact, at this moment, your brain is probably, you're feeling safe and sufficient personally, probably. And your brain's probably more concerned with your patient's safety. So you're just like, hey, mate, my friend, my surgeon, can you come and do the brilliant expert things you do and see this patient? Your first thought isn't, oh, maybe they're not a very good doctor and they should probably stop. You don't go there straight away. So I think that's really an important point that we bring up about how we treat other people so differently to us, and recognizing that when you see the priorities of your brain in these moments, when you know that your brain is really concerned, should I actually be a doctor right now? Am I doing the wrong thing? Should I be a doctor tomorrow? Should I come back to work or should I quit now for my safety? It makes so much sense why your brain does that. I have a lot of compassion for my brain doing that to me when I make a mistake. And with that, when you know that it makes sense, that that's the reasoning behind your brain bringing the thought up, it also helps you not take that thought so seriously in terms of the content. You know the purpose of the thought is to keep you very safe and identify threats. Tick brain, thank you. But we often think that the thought has arisen in our mind, that it's in our consciousness at that moment because it's true, which is very different to the thought being in your mind, in your awareness, at the front of your awareness right now, because your brain is just prioritizing safety. And we don't necessarily associate safety with, showing up to our white-collar jobs and being a good doctor. But for you said it at the start, it's so important to you as a person that you provide your patients with excellent care. and certainly that you don't harm them. That's really important to you and your identity as a doctor. So it is a significant threat when you feel like you're not acting in that integrity or you're not able to in the future. And that's why, I can even have a lot of compassion for my brain when, maybe it was just a blood test I forgot to order. Like maybe I was supposed to something with far less obvious immediate consequences. But I can have the same elaborate response in my brain that might go all the way to maybe you shouldn't really be doing this, because I have those thoughts brought forwards of hey, you're doing the wrong thing and this is not okay with us. This is not the standard that we accept for our identity.
Yeah, everything you're saying is just making so much sense. I feel like in some situations where you feel guilty about something, and if you have done something wrong, whether it's in your medical life or in your non-medical life, it always means that there probably are some lessons to learn. Like say for example, me in that biopsy, I definitely did learn some lessons from that. I definitely did. And for example, nowadays I would never ask one of my registrars to do a biopsy on the weekend, for example, just things like that. But also the level of training I was at being a first year, also, there was lots of things, but even my own biopsy technique also improved. My ability to see blood vessels and things improved as I went on. So there's lots of system things that are kind of by the by. And I guess also learning to integrate what you're saying, like also learning to forgive yourself and learn to trust yourself again, learn to get back on the horse. Like that's a process in and of itself. But I guess in terms of that guilt feeling where it probably does mean that you have to look at something, but equally it's very hard to look at something when you have that feeling because you just want to avoid it and it's so uncomfortable. Is there a healthy way to do that for yourself or for other people? I'm thinking about how knowing what I know and knowing how I felt that day, I would be very alert to how other people are in this situation. But I don't think it's always as obvious in the moment how the proceduralist or the whoever it is that's suffering in that way is going, so unless they they actually ask you for help. But is there a good way to look after each other and ourselves in this situation to move forward from it?
I think the first thing that I would want people to look at is the way that is often not helpful to do it, and I also think is the most common way to do it, which is to try and just push down the guilt. Whether it's from a place of, I shouldn't be feeling this, like just get on with it, just get on with your job, or the other side of it, which is, I can't feel it. These two ideas of I shouldn't be feeling this big emotion in this context. It's just silly, dismiss it. You have no reason to feel that. Or I have time to feel this. I'm going to push it to the side and keep working. For whichever, there's lots of reasons, very common reasons why we try and push away and avoid the guilt. And that's the first thing I think people need to notice, because I think that is the first most common things we reach for. We just try and make it go away because, as you said, you can't, we often, it feels so awful. We just don't want to even go there. But I think one of the greatest revelations that people get from coaching is often actually not in the thought work itself, in terms of us actually talking about thoughts and, doing these sort of bringing up implicit ideas and deconstructing them and being intentional with our thoughts, that sort of work. I don't even think that's the biggest bang for your buck that you get from coaching. But one of the most transformational things is when clients when clients recognize how much of an ability they have to be with their emotions. We spend so much of our life escaping our emotions, trying to avoid them, suppress them, put them down. And a lot of us have no idea what it's like anymore to feel an emotion, to have one of those emotions in our body. And all we know in quotation marks about our emotions is this experience of having the emotion and simultaneously trying to squash it, push it down, resist it. And that's a very challenging experience. I feel stuck and hurt and dismissed and disregarded, like I'm abandoning myself, rejecting myself. I'm so aware of my emotional experience now that when I resist emotion, it feels like I'm really rejecting myself and I'm pushing back against something that is a big force. And so it takes a lot of energy out of me. So not only is it sort of breaking down my own trust with myself, kind of rejecting myself, dismissing my experience, but it's also taking a lot of energy to push it down. And on the contrary, allowing that emotion to be in your body is actually a much less energy expensive experience, because you'll find that you're actually going with the sort of the way that your body wants to use energy in that case. You know, emotions come with this energy. They come, whether it's a physiological activation or there's just some kind of action tendency with it. Your emotions often want to move you in some way. That's sort of what proposed to be one of the evolutionary purposes of emotions, to move us into action. So emotions do often feel like they have a movement to them. And so to just move with the emotion, to let the emotion do what it kind of wants to do in your body, can be a lot easier, ironically, and be a lot less of an energy spend than you trying to fight back against that natural sort of movement of the emotion. So I think that would be the first thing that I'd want, unless you've done a bit of this work before, unless you've done some coaching, or perhaps you've seen a therapist, or you've done some personal work in your own time on emotions, I would suggest that this would be the case that all of us go through, which is that what's normal for us is just to resist the emotion. And the first most groundbreaking, life-changing thing we can do is to learn to allow the emotion to be in our body. And the revelations that you'll find in that are that it's a lot different to what you think. It's a lot easier than what you think. It takes a lot less energy than what you think. And you are so much more capable to feel that guilt than you have thought probably all your life. So I just really would discourage people, or have people question this idea that emotions are something that are really hard to handle. And if you have had experiences in the past that emotions are hard to handle, I would suggest that you look into whether that is a pure emotional experience, or if it was hard to handle because it was you fighting back against this emotion and saying you shouldn't be feeling this way, or you just need to move on or be over it by now. So I hope that answers the question in a little bit of a cheeky way, because I don't think people need to do something, or there's necessarily a number one healthy way that I'd recommend dealing with the emotions in the first instance. But for the majority of people, I think it's just the first step is really going to be taking back that layer of resistance that we have to the emotion. And you'll learn so many things about yourself, and you'll think about emotions in a different way after you do that. And then after that, we can talk about different strategies that you can add on top to facilitate the way that you experience and you use your emotions from there.
Yep, I love that. And just on that though, just in terms of, because I guess what's coming up for me thinking about how I felt and how long it took me, and I guess I would have been shoving stuff down, because I would have had to, what I would have been doing is I would have been feeling the feeling when I was at home, when I was in the car, when I was driving myself nuts by myself. But when I was in the clinical environment, I would probably feel the feeling, and then I would feel like I was going to cry looking at the hemoglobin. Then I would push it down. Then I would go in on the ward round and say hello to this patient that I had harmed. And then I'm trying not to show emotion to the patient. And I guess when you were saying that to me, I was wondering, like, in order to feel the feelings, I think there is, we've talked about this before in the podcast, how, you know, there are spaces in time where you feel the feelings, but it also just makes me ask the question, should we be, if we're having that experience and we have done something wrong or caused some kind of harm, even if it's just from our perspective, should we be the person looking after that patient? Like, it's just a constant ripping the band-aid off, open the wound, like, how on earth is... I just wanted to ask you what you thought about that.
Yeah. I had this great experience the other day. I love going to gym classes because I'm actually a gym instructor. And so I love psychology. So I find the psychology of being in somebody else's gym class really interesting. And I'm just delighted and so excited when I find a great instructor. Because to me, classes can be this wide spectrum. They can be the most amazing, enjoyable, totally synergistic time for me where like the instructor made the experience so much better and so much more enjoyable, and I walk out with this big smile on my face being like, I got to exercise and I just feel like amazing and energized by this person. I had the best experience. Or you can have those experiences with instructors that they feel just like a bit, there's some kind of disconnect there. It feels like they're kind of blocked off to you, or maybe they're not really enjoying the class. They don't seem very enthusiastic or passionate. They're kind of going through the motions. And the reason that I bring up this class experience is because the other day in the class, so I'm in a new city working in a different hospital, and I've gone to see this, gone to this class, and I've gone to be in the class with this instructor for the first time. And she was awesome. I was loving the class. I was just like, this is great energy. I'm going to be so happy here. I can't wait to come back to her next class. And then this jolting thing happened where she made a mistake. But it wasn't the mistake that was jolting. It was what she did afterwards. Because to me, I expect mistakes in every single class I go to as an instructor. I know that you will almost always stuff it up. That's the norm. But the other thing I know is that the way that you react to your mistake is so much more impactful than the mistake itself. The people in your class don't often know that you made a mistake until you called it out, because they don't know the choreography. They don't know what was meant to come next. As long as you're moving to the music and you haven't randomly gone and done a completely different move, they're probably not going to notice. And in part because they probably don't care. It probably doesn't matter that much. But what was jolting was the fact that she missed the next couple of beats after the mistake, talking about the mistake she made. The mistake made no difference to us in the class. We all just kept moving to the beat. Like the music was telling us what to do. There was no dramatic change. We were all still on track, exercising happily, getting a lot out of class. But she spent the next 10 seconds talking about her mistake. And I was like, and there's nothing really wrong with that. But to me in that moment, I was like, you just, in a self-deprecating way, made that 10 seconds about you, the instructor, instead of about the class, us. When you're teaching a class, it's always about the people in the room. It's not about the person on the stage being the instructor with the microphone. It's always about the people. And throughout the whole rest of the class, I'd been enjoying that without even recognizing that she was making it all about us. She just cared so much about us. I got the feeling that she just wanted us to have a good time. I didn't even realize it. That's just what I subconsciously was experiencing from her. But then in that 10 seconds, it was so jolting because she was apologizing for her mistake. And then she was making it about her for a moment. And that's what I probably want to bring to everybody else's mind as well. When you're at a point as a doctor and you can't make it more about your patient than you, that's probably the time where you want to check in and say, hey, should I be here with this patient right now? Or is it better for the patient to bring somebody else in? And that's not a black and white thing. Like, we make things about ourselves constantly, all the time, every minute of the day. That's what humans do. We cannot be perfect about this. I'm sure I spend like 90% of the day just thinking about myself, all my thoughts about myself, right? Not about other people, because I'm a human. But we need to work out for ourselves, and we need to assess the specific situation. Is this a place where my thoughts about me, my doubts about myself, my self-criticism, however this situation has affected me, or whatever emotions are overwhelming me at the moment, is this position that I'm in right now taking something from the patient? The truth is,
that instructor taking that 10-second like self-deprecating moment for herself where she was kind of apologetic took nothing from the class. I would have come back to her class 100 times over. But it was just jolting for me. It was just something I noticed. That wouldn't be a threshold for me to be like, you really shouldn't be instructing this class, right? But it's a very different situation when you're a doctor. And I would say as well, just on that note, for a lot of us, especially somebody listening to this podcast, it's very easy for us to be self-critical. That's probably why you listen. That's probably why you can resonate with a lot of this work, because our default is more on the end of self-criticism than the other end of being self-congratulatory or that more narcissistic side of things. But so we need to be very suspicious of our thoughts. And this is where making sure you take care of yourself, you taking care of yourself comes into the picture. Expect those critical thoughts to come in. And with that, know that you've now been centered. You've centered yourself. Again, not because you're a bad person, not because it's your fault, because your brain is self-critical and we're all working on it, right? It's good in some ways. It's good in so many ways. It's a strength in so many ways to be able to critique yourself and to always be checking yourself and getting feedback. It's good in some ways. But it also is a weakness, if you like, in this specific context, when you are so self-critical and you believe the thoughts in the moment such that it hurts you and you now become the person who needs to be supported. In that situation, I don't want anybody to criticize themselves further. That's how you got here. I want you to recognize that the next step is that you support yourself so that you can show up again for your patient and who you want to be in that situation. So you just can't skip the self-support piece of this. That's going to be a part of you being able to show up for the patient in the way that you want to. So please do not use this concept that your self-criticism can take from the patient to beat yourself up further. It's just something to be aware of. And you'll probably recognize when you look at the scenarios that for somebody who's so caring about doing a good job, it's going to be a pretty high threshold for when you being that kind of person does start to really take from the patient. And when somebody else subbing in for you would actually be a better thing. Because in general, when you've got a doctor who cares that much, they're probably going to be doing a baseline excellent job of taking good care of patients. And so you've got a lot of reserve to work with as well. You know, you cannot be in your best, most polished position that day, and you can still show up to that patient even when you're struggling and still add so much to them just because you've got such a high baseline of being a great doctor and doing a good job.
Yeah. You've kind of left me speechless, and I was listening to that just thinking, if we never made another podcast and that was the kind of drop the mic over and out finale of the whole podcast, like I don't know, I ask you questions, Beck, and sometimes when you answer them, I'm just like, how did she do that? Like, I feel so seen and heard on behalf of past me, current me, all the moral injury I'm ever going to have, all the mistakes, unfortunately, that we're yet to make. Thank you on behalf of past, current and future me and all of us listening. I feel like you've given us a way through what otherwise feels like an impossible situation when you're in it. So thank you so much, Beck. And I guess just a big shout out to anyone who's in it at the moment. We all are in it at some point, and look after yourselves and each other. Yeah.
See you guys next time.
I've been waiting all my life for something. I've been down the darkest roads and up in the clouds.